One of my favorite functional evaluations for any lower extremity injury, basically from mid T-spine all the way down, is the lunge. It's a great window into overall functioning, and it can really start to highlight dysfunction that's going on in that injury. So in this week's breakdown, I'm going to be covering how I break down a lunge. Well, what's up, everybody? Dr. Matt Maggio here, creator of the 𝐓𝐡𝐞 method and founder of the Soft Tissue Revolution, where we teach massage therapists a new treatment method that focuses on working smarter, not harder, allowing them to make well over $100,000 per year with less than 20 hours of time per week in the clinic. A lot of times, especially your very active clients, maybe your athletes or people that work out a lot, they're addicted to their exercise and they want to be able to do all these things. And you end up being that practitioner that kind of tells them what they want to hear instead of what they need to hear, and you end up being the bad guy. So one thing that I like to do in my system, the 𝐓𝐶 method, is show them real data and real tests so they can be more objective about what's going on. And the test can really end up being the bad guy in this situation, because you can show them and be like, hey, based off of this test, you have a lot of dysfunction in there. And if you go out and try to run, it can cause some issues in there. So the one test that I really like to use, especially for lower extremity injuries, is the lunge. So what I want to include in this week's breakdown is me going through how I assess the lunge, some of the faults that we see in the lunge, and how they can really give you a window of what's really going on, but also have like a benchmark or a goalpost for the client to know when they can get back to full activity and doing the things that they really love. So let's check that video out. Go through just breaking down the lunge assessment. When you do the lunge assessment at the end of your lumbar and lower extremity evaluation, you want to get the video, and a nice, easy, normal lunge should look very easy. It should be like the person is curling like 5 or 10 pound dumbbells, and they should be able to easily do 10 to 20 on each side. The lunge, I always say, is a really good bad guy. They're the one that tells the client that they can't do certain things, because they come into you and they say, hey, I want to be able to run 15 or 20 miles or bike or do this, but the problem is they're not functionally doing what they need to, and that'll come out in the lunge. So take the video and show them what normal would be. And a normal lunge is just kind of going back and forth, nice and easy as you go. And if your lunge isn't good, you should get it fixed, because you always want to show the client that they're doing well. So a couple things that we want to see on a normal lunge is when they do start and they hit, they should hit with their heel, just like that. And then once they hit with their heel, they should be able to drop down nice and easy. That's the first thing that I look for, is that they hit with the heel. Now the next thing that you want to see is that they also push off with the heel. So they hit with the heel, they're down, and then they're able to push back just like that. That's a good sign for me. Now, another thing that we should see is that their knee stays nice and straight. So when they go down, their knee should be in just like that. We shouldn't see that it curves in at all. If it does curve in, that's another compensation that we look for. So the first components are heel strike, and then push off with the heel. Then the knee stays straight. And then the last thing we want to look for is that they're upright. So when they go down, they're upright. And a lot of times that's a good lunge. A lot of times you'll see like a forward lean as they go through. So what we want to see is upright, heel strike, push off with the heel, and knee. So I want to really emphasize what some of those faults look like so you can really get a better idea. So come on over. So come over here a little bit more. So the first one would just be the toe. And this is one of the most common ones. You can see here, you can see how she's pushing off with her toe, and then do the toe land here. That's definitely one of the major compensations that we usually see with the lunge. And then the next one you're going to see is the knee kind of turning in a little bit, where it'll kick in from there. It's not parallel from where we are. And see how that knee really drives in. And then the last one we're going to see is, face that way for me, is going to be that forward lean. One more. Good. So a clean lunge is really important. It's functional based, gives an idea of what's going on. And then when you have these three faults, it can really give a better idea of like where the tissue compensation is happening, how they're functioning overall. So I'm going to explain it a little more in depth. So I always say there's 3 faults when it comes to the lunge: knee in, toe land and toe push off, and forward lean. Now when the knee kicks in, this one is really positive for what's called a sciatic nerve entrapment. And you're going to see that in that test we did where it's the sciatic nerve functional test where we bring their legs straight up. And a lot of times when there's an entrapment on the superior gemellus of the sciatic nerve, that knee will want to kick in. And that'll give you a better idea that that's what needs to be treated on those lower extremity and lumbar functional tests. The next one is just going to be that toe off, toe hit, and toe push off. This is going to be a combination. It could be some of that sciatic nerve entrapment up high, but a lot of times it's really just a weak posterior chain. So what happens for so many people is they become very quad dominant. And when they're quad dominant, they put a lot of force through their quads and they don't use their hamstrings as much. So you always want to ask, why is that posterior chain weak? There could be a lot of issues going on. A lot of times the posterior chain goes weak because there's some problems in the lumbar spine. There could be some disc problems and the hamstrings tighten up to protect that. So it'll appear like it's very weak. And then the last one is just that forward lean as they go down. You know, you should be able to be nice and upright, but they go forward like that. Once again, that is another problem with the posterior chain. So many people have posterior chain weaknesses. So a lot of people go, oh, well, if the posterior chain is weak, we need to strengthen it. And yes, you do, but first you got to get that scar tissue out of there, because scar tissue is like glue that gets inside the muscle, makes it weaker, less flexible. And if we don't get that scar tissue out of there, we can strengthen it all we want. It's not going to come back. So the lunge is my favorite overall functional assessment down low because it lets us know how they're moving. It lets us know if there's any dysfunction in there and biomechanically how they are as well. And it's a great tool to show the client that they're making good progress in their lumbar spine and hips as well, especially if you get them to come in, they're like, hey, I want to run a marathon, and you look at their lunge and they're like all over the place just like this, and they can barely do a lunge. And then what they'll say to you is, oh, I just have bad balance. They don't have bad balance. They actually have very poor biomechanics, and your job for them is going to be like, hey, we're done and you can function how you want to when you can give me 10 lunges clean on each side. So it becomes almost like a competition and they want to get better. But breaking down, is it kneeing in, is it toeing, pushing off, or is it a forward lean, also correlated with what you find in all those evaluations, will really help you get to that tissue specific problem and fix it for good. So the take home from this is a couple multifaceted approach. One is the tests just really give the client the idea of who's being the bad guy. You know, if I get somebody that comes in and they have knee pain, low back pain, hip pain, and they're like, I want to run 50 miles a week, but I keep getting hurt. I'm like, you can run 50 miles a week when that lunge is cleaned up. It also gives you some really good objective, real data that that client is actually making progress. And it puts things in a different perspective. You know, they focus so much on the short term. They're like, hey, if I can't work out, I'm going to be in a big problem. You're thinking like long term for the client and showing them, but it really separates you from being the bad guy or the bad woman in this situation, because you're giving that client real objective data that they are starting to improve. And then they want to get better too. It helps them become more active in the treatment process. So in closing, you know, basic injuries go simple for me. On one side you have load, and on the other side you have what's called capacity. Load is what you do, capacity is what you can take. Us as injury practitioners, what we're doing is we're improving the client's capacity so they can do more load. But usually what happens is they're doing too much in between, and that load continues to put the strain on the capacity. So we're fixing their capacity, but they do more load. These are when you have those clients that you like get frustrated with. They're not getting any better. They're not following the process. And the lunge really helps that. And giving them functional data really helps them understand that they have to participate in treatment. So many clients come in and they go, here's the problem I started. You put the fire out. I'm not going to change anything. And that's set up for failure for everybody. It's set up for the client to fail. It's sure as hell set up for you to fail, and it makes you really frustrated. So start focusing more on objective data, showing them real things instead of just like that subjective, like, hey, how do you feel? They're like, hey, here's a video of your lunge 3 weeks ago. Here it is now. Look how much freaking better you are. And it gives them real data that they're making progress throughout that. And that's what we teach and we share in our free training and our CEU courses, on my YouTube channel, everything like that. So if you like the video, give it a comment, a like, a share. If you want any specific topics you want me to cover, send me a message. Always here to help. And I will see you guys on the next one. Bye.